Breathing for Peak Performance, Chapter 2, Ribcage. The thoracic wall consists of 12 ribs, the thoracic spine, the sternum, and an array of articulations, muscles, and ligaments. The interaction of these parts is complex and it is important for breathing, spinal stability, and movement. The thoracic wall can flexibly expand due to the articulation of its ribs with other parts of the body wall by true joints. The shape and the orientation of the ribs contribute to the expansion of the thorax. The ribs attach posteriorly to the thoracic spine and anteriorly to the costal cartilages. All ribs connect to the spinal column, but only the upper 7 connect via their cartilages to the sternum. They are called the true ribs. The remaining pairs of ribs are called false ribs. The costal cartilages of ribs 7 to 10 connect with the costal cartilages of the ribs above them, whereas ribs 11 and 12 have no anterior connection. This arrangement allows the inferior part of the rib cage to be more flexible and adaptive to the movement of the diaphragm and organs. The ribs are the most flexible bones in the body. They consist of a curved and a slightly spiral shaft. The part of the rib that connects to the spine is characterized by a head, a neck, and a tubercle. You can metaphorically visualize the head, neck, and tubercle of the rib as a foot in a slipper. The heel is the tubercle, the head is the ball of the foot, and the toes and the arch of the foot is the neck of the rib. There are usually two articulations, the costovertebral and the costotransverse joints, that connect the ribs to the spine. The costovertebral joint is formed by the head of the rib connecting into a facet formed by two vertebral body, its own and the one above it. Ribs 1, 11 and 12 articulate only with their respective vertebrae. The costotransverse joints are formed by the tubercle of the rib connecting to a corresponding facet on the transverse process of the associated vertebrae. During inhalation, the backs of the ribs rotate and slide down in their respective joints while the shafts of the rib rotate upward. The angle formed between the two joints determine the movement of the individual rib. The costovertebral joints 9 through 12 are shifted posteriorly, creating the more lateral bucket handle movement. The 1st to 7th ribs connect to the cartilage around the sternum, which connects to the sternum itself, called the chondrosternal joints. They are synovial joints which have some ability to rotate and slide during breathing and movement. The connection of costal cartilage of the first rib to the sternum is fibrocartilaginous, creating the firm connection between the movement of the first rib and the sternum. The body of the sternum is flat and slightly curved forward. The joints between the body of the sternum and the xiphoid process usually form a symphysis. Only slight movement is possible in these joints during breathing, but maintaining this flexibility throughout your life is important. The posterior attachment of the ribs to the spine is generally superior to the anterior attachment. Therefore, when a rib elevates, it moves the anterior thoracic wall forward relative to the posterior wall, a movement like the lifting of a pump handle. The middle part of each rib is inferior to its two ends. When this region of the ribs is elevated, it expands the thoracic wall laterally. This movement is like lifting of a bucket handle. The inferior two ribs are not attached to cartilage in front. They simply move backward like the opening of a caliper. The first two ribs are flat and they lie close to the horizontal plane in an upright position. Their action is mostly of the pump handle type, while the ribs in the middle of the thorax move more laterally. A slouched posture tends to lower all ribs anteriorly and reduce their ability to increase the volume within the thoracic wall. Because the ribs have some ability to move forward, laterally and backward, and the diaphragm moves downward on inhalation, lungs can be expanded in a three-dimensional fashion during inhalation. During quiet breathing, the movement of the diaphragm dominates. During deeper breathing, the movements of the ribcage become more prominent. Following are 5 exercises and imagery explorations for the ribcage. Three-dimensional thoracic movement. In this exercise, you will focus on the three-dimensional movement of the ribcage during breathing. Start this exercise in an upright sitting or a comfortable standing position. Place your hands on the sternum. One hand is on top of the other. As you take a deep breath, notice how the sternum moves upward and forward. This is the pump handle component of your thoracic breathing. Place one hand each on the sides of the middle section of your rib cage. As you inhale, notice how these ribs move laterally. Imagine as the handles of a bucket that are moving up during inhalation and down during exhalation. Place your hands on the lowest ribs just above the pelvis. As you take a deep inhalation, feel how the lowest ribs move posteriorly. Imagine ribs 11 and 12 widening and moving backward into your hands when you inhale and forward again when you exhale. Finally, imagine the combination of these three movements to the front, side and back. As you inhale, imagine the movement forward to the front, side and back. As you exhale, imagine the reverse movements. During your sport or exercise practice, focus on using three-dimensional breathing in your ribcage rather than focusing on only one dimension. Imagery for releasing tension of the ribcage. Imagery that facilitates the flexibility of the ribs and the ease of their movement will improve your breathing capacity. The best metaphors are often the ones you discover yourself. This exercise provides 2 examples to get you started. Stand or sit in a comfortable position and imagine tiny balloons attached to the shafts of your ribs. As you inhale, these balloons help to lift your ribs upward. As you exhale, the balloons release their pull and the ribs float back down. Imagery for releasing tension in the ribcage continued. Imagine your ribcage as a soft cloth suspended from your first rib. As you inhale, the cloth swings outward. As you exhale, it drops back again. Elastic sternum and rib cartilages. The sternum and the adjoining joints and cartilages need to slide, move and twist as you breathe in this exercise. You use imagery and touch to facilitate these actions. Sit upright or stand in a comfortable position. Place one hand on the manubrium and the other on the body of the sternum. As you flex and extend your spine, imagine the small and subtle movement at the manubriosternal symphysis. Touch the joints between the cartilage and bone on the left and right side of your sternum. They may feel a bit tender. As you inhale and exhale, imagine slight sliding and rotating movements at these joints. Imagine cartilage performing a slight spiraling action as the ribs rotate up and down during breathing. With your fingers on the cartilages, perform spinal flexion, extension, lateral flexion, and rotation, and feel how the cartilage adapts to both movement and breathing. Remove your touch and notice changes in your posture and breathing. Most likely, your sternum will feel as if it is naturally more lifted, and it will be easier to breathe in front to back dimension. Down and back, up in front. During inhalation, the ribs rotate posteriorly in their costovertebral and costotransverse articulation. This means that the backs of the ribs are moving down while the fronts are moving up. Sit upright or stand and visualize how your ribs connect to your spine. As you inhale, visualize the movement of the ribs. They are rotating posteriorly in their costovertebral, costotransverse joints. The backs of the ribs are actually moving down. Imagine this down the back feeling facilitating the up in front action of the ribs. If you focus on the whole rib moving up on inhalation, it will actually impede your breathing. Tapping the rib cage. With the help of your hands or a pair of balls, you can loosen the rib cage and create more elasticity in the intercostal muscles. For this example, use orange Franklin method balls or simply make loose fists with your hands. Sit or stand in a comfortable position. Tap the right side of your rib cage with your loose fists or two balls. Flex to the side as you tap. Rotate your spine as you tap. Then flex and extend your spine as you tap. After a minute of tapping, rest for a moment. Compare the breathing and rib motion of the right and left sides. Repeat the tapping on other side.